All right, everybody. Good evening and welcome to the March Pathway session on craft with Erica Lubetkin. As most of you know, I am Paul Reinhardt and I'm the founder of the New Canaan Parent Support Group. We have every Thursday a parent support meeting, and we also host monthly pathway sessions like this one. And if you did want to learn more about us, you can always go to ncparentsupportgroup.org. And before I introduce Erica, I do want to take a stab at what I said I was going to do, which is define CRAFT, which stands for Community Reinforcement and Family Training. I'm sorry, Family Therapy, right, Erica?
Family training.
Oh, training.
It's training.
Okay.
Yeah, it's a mouthful.
Yeah, I'm already messing this up, but here, but the CRAFT methods draw on the principles of both social modeling and positive reinforcement to teach family members what to say, what to do, and how to behave when faced with a loved one's substance misuse. It's an important skills set of, a set of skills that any family member can use, whether their loved one is still using in treatment or in long-term recovery. And in fact, this skill set can be used in all personal relationships. Wouldn't you say, Erica?
Yeah. Absolutely. You
Okay.
can use it on your wife, you can use it with your husband, you can use it on your kid.
All right, so now just a few words about our speaker. Erica Libetkin, LMHC, is a psychotherapist based in New York City. One of Erica's specializations is helping clients with addiction and their family members. Erica is one of the few New York State providers fully certified in CRAFT, having been trained by CRAFT's creator himself, Dr. Robert Myers. And after Erica speaks, we're going to just open it up to Q&A, and that might happen very soon, depending on what people have that they want to get out. But Erica, I know, will have some specific tips and give a little history on CRAFT and what it is, and really give a better definition than I did. So, without further delay, would you please join me in welcoming Erica Lubetkin?
Woo! Thank you. Hello, everyone. Good evening. So happy to be here. That was a really good definition, Paul. So you've got it. So I'll just add a few things. I first learned about CRAFT a long time ago when I was working at the Center for Motivation and Change, and they were writing the book Beyond Addiction. Then I went to grad school. Then I got my first job at Hazelden, the intensive outpatient program here in New York City. And in that program, it was almost like my brain got wiped and I never had learned about CRAFT because there was so little family involvement in recovery and the treatment. And within like the 8-week IOP curriculum, only 1 hour was allocated to like a potential family session. And it wasn't until I left Hazelden that I realized that there was a huge gaping hole in the recovery system for family members and loved ones. And giving a handout of Al-Anon meetings wasn't sufficient, in my opinion. So I started working with this startup called We the Village, and it's an online platform for family members and loved ones, for all people like us, and it used the CRAFT approach in all of like the advice giving and the forum. It was all like, it used to be an online forum, and we grew it into a course program, and we got funding from NIDA to do a clinical trial to test its efficacy. I'm so not a researcher, so I like doing the actual like therapeutic work, not actually like the research part. But we we did that. And in order to do that, I had to get certified. So that was like kind of my journey to sort of getting certified in craft. And I think that it's one of the coolest gems there is, because I always am surprised in a good way to see like glimmers of hope, the things like the ways in which it works. I'll get into that. But that's just a little bit more about like why I love craft so much, and why I really leaned into doing this kind of work. And also, everybody knows somebody who's struggling with substance use. Doesn't matter who you are. So it touches everybody, unfortunately. So it's kind of like, if there's support groups at Sloan Kettering for people who are getting chemo, for the caregivers, why aren't there similar things for us? So yes, that's a little like, passion spiel from me. So that was a really good definition. I'm going to just give a little more meat in that definition, if that's okay. Basically, craft is a therapeutic technique for family members and loved ones supporting someone struggling with substance use that encourages behavioral change via our behavioral change. So it's kind of a modeling experience. We learn how to communicate in a new way. We learn how to use positive reinforcement, removal of rewards, lots of different things that have an impact on our loved ones, whether we verbalize it or not, whether we, whether they know that we're learning about craft or not. And basically the approach is of compassion, curiosity, kindness, science. There's no detaching with love. At a certain point we can get there, but we try not to go there immediately, I'll say. The word enabling is not used in craft unless you give somebody money for drugs or give them drugs and alcohol. And there may be a few other like terms that we don't use really, but so yeah, it's a really different way of looking at supporting somebody that's really hands-on, and it's as if like you go into treatment yourself too, because it's learning a whole new way to engage with our loved ones who are struggling. So yeah, I would like to, I'm gonna jump into the 3 major goals of craft, and because it can be helpful just to like understand that the goal is not just get somebody into treatment, but one of them is engage our loved ones into going into treatment. The second one is to decrease the harmfulness of the substance use. So if they never wind up in treatment, even the decrease in their use or harm reduction approach, or, there's no one size fits all. So it's kind of like figuring out what works is considered like achieving the goal. And then the third one is independent of whether or not our loved one enters treatment, we increase our own happiness and self-care. And that is something that a lot of people, I think, are missing in this sort of journey and this experience and this wild, crazy trip of supporting somebody, taking care of ourselves. So those are like the major goals. And it's, like I said, it's all behavioral based. So it involves a lot of changing of our behaviors, which sometimes people say, oh my gosh, I have to do so much work. This sucks. But then they start doing it and they see the outcome and it's like magic. It's awesome. So just to give you some information, the other sort of like family interventions are sort of like the Al-Anon approach, the Johnson Institute intervention approach, and doing nothing. And studies have shown like over and over again the efficacy of the craft approach in engaging loved ones into getting into treatment when compared to the intervention model or the Al-Anon model. And I can give Paul a document to send out if people want the stats on that. So basically, there's a bunch of protocols that you go through. It's not a forever thing. It's not like you go to your therapist forever. I mean, if people want to see me for longer than the protocol sessions, I'll see them. But ultimately, it's like teaching people certain skills that they can then take and apply into the real world. And once you have the skills, you have the skills. And some of these protocols are communication, getting a glimpse of roadmap of our loved one's substance use, the use of positive reinforcement, problem solving. There's a ton of them. All the chapters of Beyond Addiction, I'll say. But the most important one, in my opinion, is communication. And I'm gonna go into sort of like the 7 tips for positive communication because I think it's very helpful. I was telling Paul before that we learn from such a young age how to communicate, and that becomes like our default. And no one ever teaches how to effectively communicate. Maybe there's a Sesame Street episode somewhere on YouTube. Maybe I don't know. It took me until I was in my 30s to like really learn what positive communication looks like. It was something I was saying, like kids, one day I hope the kids are learning this in school. Because if we can't ask for what we need, we'll never get what we need, basically. And when we operate from a place of emotion and fear and intensity, we generally don't get our point across effectively. So before going into the 7 tips, it's important when you're thinking of having a conversation to ask permission to have a conversation with whoever the person is. Because, I mean, just think of any time in your life that somebody's barged in and demanded that you talk through something in the moment and you get super defensive, perhaps. Speaking from my personal experience, if anybody barges in, we need to talk. I'm like, what did I do? I immediately get defensive about it. So by asking permission, hey, there's a few things on my mind. I was wondering if we could, touch base later tonight and chat. It allows our loved one to feel like they're an active participant rather than a passive recipient in the conversation, in the communication, and it kind of opens it up for a dialogue, if you will. When you're thinking of like timing for asking permission, it's important to make sure that we don't ask our loved ones when they're like really intoxicated. We kind of want to find that sweet spot in the day that we know, like maybe after the first cup of coffee. It's different for everybody. But if you're planning on having a conversation and then someone comes home drunk or high or whatever, just back away from the idea and return to it when they're in a better headspace so that you can actually get somewhere. Does that make sense? Okay, cool. So that's like the precursor for positive communication. And the reason why I'm saying this is because this is the foundation for every other module. Like this is necessary in order to implement everything else effectively. And it's also like, it works immediately. It's wild sometimes. So the first tip is be brief. So by keeping what we're trying to say short, we get our point across more effectively. If it's diluted with, and last week this happened, and your teacher called, and all of this information that's not relevant, the point gets lost. So we want to keep it brief. And I always encourage people to write out what they want to say so that they don't get like lost. You don't get lost in a ding on your phone or, the dog barking, whatever it may be. But you want to keep it brief, like a paragraph, I'd say, at the most. Tip number 2 is be positive. So you want to have like a little bit of a upbeat demeanor. And instead of saying things like, I hate it when you drink, you want to say things Like, I love being with you when you're present and connecting. And it's so awesome to have that experience. And being positive also refers to having, like, creating a space for that open-ended questioning so that you can have a dialogue versus you monologuing. So that's tip number 2. Tip number 3 is be specific and clear. So you got to really hone in on what the thing is that you want to address. And the more specific, the better. For some people, saying, I need you to do the laundry is not specific enough. They need to hear, I want you to, when the machine dings, I want you to put the stuff from the washer into the dryer. Like, that's specific. And I always encourage people to, like, make a list of the things that they want to have conversations about and kind of like make it a hierarchy of importance and sort of go from there, and have it be like a living list. But yeah, the more specific and clear, the better. That can look like so many things. It could be, you need to go to your therapist. You need, like, I want to talk to you about whatever it may be. It can be doing chores. It can be therapy. It can be rehab. It can be, again, anything. The 4th tip is label your feelings. So instead of saying, you make me so angry, or you make me feel so worried, simply like flipping it around and saying, I feel worried when you don't come home till 3 a.m. It's a simple thing, but like, we're responsible for our own feelings. They already probably feel such shame and guilt that saying, you make me feel this way, adds on to that and makes our loved ones feel worse. And that's something that definitely we can apply to every relationship in our life. The whole, I feel this. Offering an understanding statement. So kind of like letting them know that you get it. Like, I get that you want to go to the party and get high with your friends. I get it. Like, you want to be socializing. I understand. Or I get that, you're really stressed out with trying to get into colleges. And that this is your outlet, but we need to, like, kind of work on another outlet, music or whatever it may be. But offering that understanding statement, again, it puts you on a level playing field in some ways. The next one is number 6 is accept partial responsibility. This is the one that sometimes people have a hard time with, but it's really important to acknowledge and let our loved ones know that, like, we're imperfect as well. And that in the past, maybe, a sample sentence is, I know in the past my reaction has been filled with anger, which I recognize isn't helpful. So I want to work on solving this together. So by letting them know, like, I'm not perfect, it also sort of neutralizes the whole dynamic, because you're saying, like, I'm flawed too. Like, I've got it, I sometimes mess up too, all of those things. And in certain dynamics, our loved ones can think like they're the screw ups and we're the perfect, picture of what, a good person looks like. I don't know, but like, I think there's a lot that it can get difficult. I know definitely with siblings, like if a brother is using substances, they think, and their sister isn't, they think the sister is like this angel who can do no wrong. And so for the sister to be like, listen, I fuck up too, it can be really powerful. And then the 7th tip is offer to help. And this is where you sort of brainstorm and deliver possible ideas. How can I help? I was thinking of this therapist, that therapist, this group, that group, whatever it is that makes sense for your situation. And then sort of going from there, and you can, wrap it up always by saying, like, does that make sense? Or what do you think? And like I said, it's pretty wild what happens when you just start shifting the way you communicate a thought or a need, like, immediately. And you don't have to always use all 7 tips, but you always have to think about asking for permission and timing, for sure. So that's that on communication. I want to ask if anybody has any questions, and I can also give a few more like nuggets from other modules at a certain point, but I want to check in and see if anybody has any questions about that or sees how it could be helpful or not.
Could you say the last tip? I'm sorry, I was writing it down and I got,
Oh yeah, it's
Behind.
offer to help.
okay. Thank you.
Yes. Yes.
Erica, would this be a starting tool for communication? If
Mhm.
you're just beginning into the process, are these the steps you would recommend taking?
I think that this is a really good starting point because you're starting off with positive communication versus fighting versus, you know, kicking out of the house versus whatever the alternate may be. And it's interesting that it's also, it becomes a little contagious. So when you start communicating in this way, other people pick up on it, either say like, what's wrong with you? Why are you acting so differently, or why are you talking differently? But also like you get responses in a different way that like I've said, lead to sort of a more productive outcome than just arguing. I definitely think it's a good starting point. Like I truly wish that everybody knew this from like a young age, these tips. I wish I did.
I'm wondering, because I've dealt with different families sometimes and heard different ways that they respond to suggestions like this. And sometimes when a loved one has been through, you know, different types of treatment, has seen several therapists, counselors, etc., sometimes they kind of get talk therapied out, and they might. I just heard this today, actually. You know, how do you deal with it when your loved one says to you, don't try to be my therapist. You know, you're talking to me like a therapist. Because some of these could be kind of construed that way. And I mean, I think they're great and they're wonderful, but some of them, like I said, because they've been through so many different types of programs, sometimes it's just
right.
So how do you kind of deal with that?
Yeah, that's a really good question, because a lot of these modules are actually like therapeutic techniques, and I think, you know, there's a lot of trainings that people can be like peer coaches and stuff. So it's kind of I can totally see how that could be an issue. I would say like, no, I'm not your therapist. I'm your ex, and I'm trying to figure out a way to communicate with you that will work and a way that you'll listen. If this isn't working, tell me what will, and sort of let them guide you and meet them where they're at, because that could also just be like a resistance tactic. You're not my therapist. It's like, you're right, I'm not, but these are really cool. Like, this is a technique that I am trying to learn so that we can get somewhere at this point. And I don't want to be your therapist or your coach or anything. I want to be your parent, period.
But you get a lot of.
That's interesting.
Thank you.
Yeah.
I like the fact that the first thing we need to do is to establish permission. I think that creates buy-in. They're in the game, and we've asked them to be in the game with us, and they said, okay, let's have a conversation. So that's a real stable starting point when, you know, we don't start out by shooting on them. You know, we start out by saying, hey, would you engage with me a little bit? You know, yeah, I will. Great. Let's move forward.
Yeah.
You know? Thank you.
Definitely. It changes a lot, because barging into someone's room versus like having a set time that you'll have a conversation, the outcome's going to be different.
I have two sons that are both in recovery, and I'm in recovery myself, and it took me some time to figure this out, or to learn how to communicate with them, and to get them to not run away from me. And I had to change, not them, but me, and that's what this is all about, just changing approaches. And for me, it was softening,
Mhm.
myself a little
Absolutely.
bit.
Yeah, that's awesome to hear. It's not like we are trying to like actively change them, but it's a process that occurs when we work on sort of engaging and having different reaction, responding versus reacting, for instance, or kind of softening, like you said. I like that. I like that. And it's like a byproduct almost of us doing this craft work.
And for me,
Yeah,
it's a byproduct of participating in 12-step recovery as well.
totally. Yeah.
And attending things like this and doing some readings here and there.
Yeah.
Yeah.
Absolutely. And this is not at all to say that 12-step and Al-Anon doesn't work. It's
I get it.
make your own poo-poo platter.
Mm-hmm.
Like, make what works for you. Go to the salad bar and take like what you like.
Erica, what do you do when you use the phrase, I understand? And quite often people then might say, you can't possibly understand. Why do you say something like that? What do you say?
Well, when you're saying it, do you truly understand?
Depends.
Right. So it's like, I could say like, I understand wanting to be with friends and wanting to get high because I used to do that too, or something. I don't know. It depends on like the level of transparency that is in the relationship. Or, I can understand that you have ADD and this could help sort of self-medicate that. Like smoking pot is a go-to self-medication for ADHD. And if they say you don't understand, you could never understand, you don't get it, then you can always say, you know what, you're right, because I've never experienced that, but I can empathize and I have compassion for what you're going through and what you're experiencing. And I'm trying to, in some ways, let you know that I get it. Like, I get why you are in a place where you're abusing this substance. I don't think it came out of I don't think it just fell on your lap.
Okay, thank you.
I think that could be helpful. I just kind of came up with that, but like, you know what I mean? Sort of always reworking and rephrasing. A lot of this is about experimentation. If something doesn't work, try something else, to get out of that insanity loop, and to really understand that no one size fits all. Like, this is a great 7-tip, guide, but maybe somebody doesn't resonate with a certain tip and you have to adjust it for that person. Just like 28-day inpatient treatment doesn't fix everybody, so it's like I said, it's work that we have to do. But you could never understand, you don't understand. Okay, you're right, I don't. And sort of giving into that and seeing what happens. And if you're met with just a lot of combativeness, back away and return to the conversation another time.
So at some point, if you're going through the 7 steps and someone gets really angry, either at you or whatever it might be, is that your point about just back away and let it go?
It depends on the intensity of the anger. If it's, why are you talking to me? Why are we having this conversation kind of anger? I think, we all know our loved ones better than anyone. So we have to sort of gauge what the barometer is there. But if it's clear that it's not going to go anywhere, the best thing that we can do is say, okay, I see that, you're a little activated right now. I'm going to leave and we can talk about this another time, and sort of just backing away, because there's no use at that point. But if somebody gets irritated, you can always say, can I just finish what I have written down? you just give me like one more minute, you know, and see what the response is. And if the response is F you, then okay, I'll back off.
Thank you.
It can be scary to try and implement this because it can be so new for some people. But I always like to think of it as like, what's scarier, not trying it and maybe potentially not getting anywhere and still fighting and, you know, having them get upset and all of that stuff, or trying it and it maybe not working, but most likely working and learning how to engage in a new way. But it's new. You know, I was telling Paul earlier that I go over these tips all the time. And sometimes I like black out and not from drinking, but just like will get upset with somebody and just not use any positive tips. And then I'm like, whoa, reel it in. Gotta like get back to the tips. So it can be interesting. I don't want to say daunting. It can be interesting, but it's so helpful because it lets you like actually say what's going on and what you need and what you want to see from your loved one. And when you get into all the other modules, like the use of positive reinforcement, which is the phrase that we use instead of like, I guess, enabling. It's sort of like reinforcing positive behaviors that we want to see. If a positive behavior is giving my son the remote control for an hour at night because he came home sober and not high, then if you can use communication to link why you're doing that in the way, sort of in this like positive communication framework, it can be really powerful. So they know that this is a reward. So it sets in, it's not just an expectation. And I'm happy to go more into that too. Rewards.
And what you're saying is if he came home really high and you wouldn't give him the remote control, so it's just the absence of the positive reward as opposed to yelling and screaming at him.
Yes, absolutely. So yeah, it's positive reinforcement and time out from positive reinforcement, which is withdrawing of the reward. So it's like the communication part is important. So they know that this signals like you're doing good, amazing, and they feel the consequence when the reward gets withdrawn. And you can sort of talk about it like, you know, you've been doing so well the past few weeks. I'm so proud of you. I want to talk to you just about like what I'm thinking in terms of TV time. I'm gonna give you the remote and you can have an hour of whatever you want to watch and we'll all watch it with you. If you come home on time or so, whatever the limit is for your individual situation. If you come home, you know, by curfew, then you'll get like the TV time. But I want it, like, I also want you to know that if you come home later or stoned or drunk or whatever, you're not going to get that reward. So the reward always, and this is like pivoting from communication, but again, you need to sometimes communicate the whole reward process. So the reward needs to be small enough and easy to access so that you can give it and take it quickly. So I always say like it shouldn't be a Rolex. I don't know why I say that. I don't even like, I've never even wanted one. Maybe I do, who knows? Maybe this is my subconscious, but it needs to be something like really small, like a walk together, or again, listening to music that the other one loves, or I mean, there's so many things that it could be, like not money, but you know, making waffles in the morning, for your kid, or what, the lists are sort of endless when it comes to brainstorming about this stuff. But then when they come home high, taking it away. And not necessarily in the moment saying anything about it, but the next day, if you want to bring it up, you can. Trying to engage with somebody when they're under the influence is just, it can be pointless. So like, basically, like, if we think that they're high and we think that something's squirrely is going on, we're most likely right. So like, that's an indicator to not engage for us. Because where will that get us? You're drunk. No, I'm not. Yes, you are. No, I'm not. Yes, you are. It's.
I think the technical term for that is a pissing contest.
Oh, okay.
Yeah.
Yes, it was in all of my manuals for sure. And so all of this leads to, I'm kind of like lumping a few of the modules together for you, just so you have like as much takeaway as possible. But it leads into sort of allowing our loved ones to experience the natural consequences of their substance use. And this is not like when it comes to driving or safety and, livelihood, intervene. Don't allow for the natural consequence. Don't allow for drunk driving. But if they usually pass out and don't plug their phone in, and we, because we love them, plug their phone in, sometimes, like, that's just one example that I've heard that stuck with me for some reason. And we plug their phone in, try not plugging their phone in, and then their alarm doesn't go off, and then they're late for school and they have to deal with the natural consequences. Because when we're constantly shielding them, calling in to school saying, oh, he's sick, he won't be in today, can somebody send home the assignments, whatever it may be, then we're shielding them from experiencing the negative consequences of their substance use. So when they start feeling it, it starts to not be as fun. So all of that like kind of goes together. We want to reward positive behaviors. We want to not reward behaviors that we don't want to see repeated. And when we see an opportunity, and like that in and of itself is a consequence, like they don't get the TV time with family. But again, every situation is so different. But it really allows for the person to understand, maybe on a level that they didn't understand before, that there are negative consequences that will occur as a result of getting so drunk that they black out, or whatever it may be.
Erica, can I ask, well, first of all, very helpful, thank you. And I am in the middle of reading Beyond Addiction.
Awesome.
I was interested to hear you say at the beginning, you don't use the word enabling, because I feel like in the work that I've been doing, that's something I'm trying to work on. Being supportive and empathetic, but not enabling. So what did you mean?
So I think that it can just be charged with a lot of negativity, that word, when somebody says you're an enabler. My response is like, I'm getting this person a cup of coffee. How is that condoning their substance use? Like, I'm getting them coffee so that they can get up and go to work, not because I think it's okay that they're doing drugs. So it's the sort of negative impact it has on us being called an enabler, and also the reality that like certain things that are labeled that, just this framework, and I also don't believe are that. Giving somebody money for drugs, like I said, or giving them alcohol, or having a full bar in your house, or whatever your pot's out, whatever it may be, that could be considered enabling. But being loving and kind, you can do all of that without supporting their negative behaviors. You can do all of that just out of, being a nice human being. Like, I'm going to make you breakfast. Came downstairs, not high. So here's some eggs and bacon. That's not enabling, but some people would say that it is. So that's why we kind of like to use this as a way of like the positive reinforcement. It's titled The Anecdote to Enabling in like the course that I run through wethevillage.co, which is interesting. But yeah, we just like to stay away from any words that could be charged with any sort of negativity or confusion on the meaning, not meeting. Does that answer?
Yes, because I do find it confusing. And I mean, my son is 22, so it's time for some independence and choices on his own. And the things that I did when he was 12, I shouldn't be doing at 22. So I'm just trying to sort through how to be supportive and empathetic, but not, well, I don't know the right word now.
Let go, but also maybe let go a little bit.
Yeah.
Of the need to anything,
Yeah.
Because I also think that there's a fear in sort of not doing those things anymore because we're so used to it. There's like comfort in that headspace to some degree.
And the addiction just makes it more complicated when
of course
there isn't the addiction. It's just it doesn't feel as risky to hand over that independence. So
yeah. And it's like, I mean, I always reiterate this. It's so no one size fits all. Like, it's so different for everyone and everybody's situation is so different. And that's why, again, there's like a whole module on like different treatment options, because so many people don't know that there's so many different options out there. So it's kind of like finding what works for you. Maybe like removing things little by little instead of like cutting everything off at once, if possible,
Could you say a little bit, go ahead. Could you say a little bit about the difference between enabling and helping?
So enabling is the way I've come to sort of understand it is literally like giving somebody the means and the access to do the behavior that we do not want to see them engage in. So if the goal is to get somebody into like a harm reduction needle exchange program, driving them to that place would not be enabling them. It would be helping them. But if they needed us to buy them, Suboxone off the street in order for them to not go through withdrawal, that would be enabling, because we don't want to be at-home detoxes. Does that make sense?
Yes, thank you.
Or just saying like, here, let's drink together. That's enabling too. Or, I mean, I truly don't believe that anybody that ever is interested in learning about this kind of stuff is actually an enabler, but that's just my belief. That doesn't have to be the universal belief. But I have found that when people tell me that I'm an enabler, it doesn't help me at all. And it doesn't help me figure out like, what do I do next? So it's been helpful for me. If it works for you, that's cool.
A long time ago, I learned a term, and it's called protecting addiction. to be used
Mhm.
instead of enabling, so that we're protecting someone's addiction when we're doing things for them that
Mhm.
would allow them to go and use more comfortably or have more access or permission, if you will. It could be calling the boss to say so-and-so's not coming to work today. That's their job, you know. So I always like that. I learned that from Diana Clark some time ago. And I use that because it's again, here it is. It's all about verbiage. Sometimes it's softer, and it's something that people will grab onto or draw closer to you instead of pushing away. You know,
Yeah,
they're using the
absolutely.
old Al-Anon shit on me. You know, that stuff.
Yeah, I like that. Thank you. Yeah, I'm
Yeah.
working with somebody right now who just started an IOP program, and for benzos and alcohol, and he can't stand when in the group, like they have to identify as I'm an addict, I'm an you know, like certain labels can be really harmful. So it's just something to be mindful of, the verbiage, definitely. And I'd say especially for like younger people, I mean, I think it could be hurtful for a lot of people, but for younger people who have sort of grown up in a world where AA is not the only option, and maybe they, you know, see Euphoria or whatever on TV, just sort of being more open to saying like things like, oh, I mean, just the term addict is not necessarily helpful, but some people find it to be useful and identify in that way. So it's kind of finding what works for your individual situation.
I have a question. I'm kind of
Mhm.
squeezing into Dee Dee's screen here
Squeeze in.
as I was drawn into this, because I love what you're saying. Thank you. My question is that, are these modules in any way, do you think, somewhat age restrictive or specific, only because the communication, obviously good communication is not, but only because our ALO is 37, is on medically assisted Suboxone, Subutex, and you know, this has been a heck of a process. It's all happened within the past couple of years. He's been clean for, you know, 18 months.
That's
and we are we believe, and we're trying to like, okay, you're an adult, you know, like we're done, you know,
Yeah.
we're not, but or we haven't been. So these modules, are they just as relevant, do you think, in terms
Yeah.
of if we were to work with you, or he was to work with you, or however it works?
Absolutely. Yeah.
Because
They're
he's in a
not
different stage of life too. He's not reacting.
totally. Yeah. Well, I think also the important thing is that not every module will resonate with everyone's independent experience in the moment that you're learning it. For instance, you could be talking about, you know, treatment entry if you're going through like a training or reading the book, and be nowhere near that, or you could be way beyond that, but it's still helpful to have the information in case you need to use it one day or at a certain point. You may not, it may not be necessary in the moment, but like positive communication and like telling your son like, we're so proud of you, we love you, like that's a you know, that's positive reinforcement, that's a reward, you know, hearing praise from parents, that's some, you know, every kid wants that no matter how old you are. It absolutely can be effective no matter what the age. I've seen it work with 15-year-olds, I've seen it work with 70-year-olds, I've seen it work with the gamut. So
Thank you.
yeah. And again, even if it doesn't apply in the moment that you're learning it, it's something that you have in sort of like a toolkit of information that you can access if and when you need to. Hopefully not, but like, you know, the positive communication
Got it.
You can always use that for sure. And the natural consequences too. If something were to, I don't want to put bad juju out there, but just in case, you know, having it's like a relapse prevention plan for ourselves.
Well, we find that the recovery dynamic that we're in now, everything is many times focused more toward people who are using or coming in and out of using, that the, you know, the recovery process of continuing on, if they're not in an AA program or a NA program, or and they're not in the consistency of, because you hit it, you know, he did not want to know that he was being called an addict because he was different, because he was, you know, he was being prescribed pain management. So it's that whole different dynamic of, and he's an adult. So it sometimes feels tricky because I want him to be an adult, and yet I recognize that he's been, you know, there's been some stunting, and still treat it with respect and love.
Yeah, absolutely. I mean, I hear that on all levels, and I think that there's a lot of thoughts in regards to sort of those kinds of dynamics and situations. But if you think about even just like the stunting, some people say that like maturity and growth sort of stops when you start using. So no matter what age you are, like maybe you're 50, but you're really 15. But I'll say, like, I've used this with so many different ages, so many different types of substances, so many different situations, that, and it works. It really works. And I've worked with people who enter my course program when their loved one is like in rehab. So like they can't really do the things or implement the things, but still find it helpful and still hold on to the material just in case it needs to be used one day.
Thank you.
Yeah, of course.
So, Erica, do you want to just mention one way of learning the craft, which, you know, besides reading a book like Beyond Addiction, could be the program you're involved with? So why don't you just say how that works? And at the end of the 12 weeks or anything, is there any communication with the loved one saying, hey, by the way, you know, we just went through this course, we know all this stuff, or maybe they would just know, but you know, is there interaction with the loved one as well?
So yeah, it's the website is wethevillage.co, not com.co. And it's an online forum, which isn't very active because we're in clinical trials right now. We're doing research, which is really cool and exciting, just to show the efficacy of like implementing this via Zoom in a group setting. And we're in phase 2, so phase 1 was effective, so that's good. But there you can sort of find you can find the course material, and the course material, and it just like on its own, you can go through. It's 7 days free. It's really affordable. Like if somebody reaches out to me and wants to do individual craft with me, but can't afford my fees, I immediately just refer them to Village and say, like, join my group when it starts, or join the next group that's starting, or whatever it may be. Or just get your hands on the course and start learning it. And it's a bunch of videos and prompts and worksheets for each module. I have found that as people go through it, their loved ones know that they're going through it. I encourage people with certain worksheets to sort of, if it's appropriate, sit down with their loved one and say, like, what are your triggers? You know, what are your emotional triggers? Who do you use with? If it's possible, just because, that can be really helpful. And also, when it comes to the treatment entry module, there's a chatter about motivational hooks and windows of opportunity. And a lot of windows of opportunity occur when our loved ones say to us, like, you've been acting really strange. What's that course that you're taking? Do you talk to your therapist about me? Like, asking those questions are moments to sort of be like, oh, actually, you want to talk about this? I'm going to share with you. And throughout the whole program, there's an opportunity, if any, person and their loved one wants to meet with me or another village coach in a one-on-one, just to talk through like what treatment looks like, and that it's not as scary as maybe you think it is based on TV, or validating a traumatic rehab experience, but also like giving a face that's young and, I say sometimes cool, to like the recovery world, so it doesn't seem so like intense and scary, just sort of normalizing. And what's the word, like when Tony Stark loses his energy, sort of just deactivate, letting a little bit of the air out of the tires in terms of like the ideas of what treatment looks like, and letting people know, like, if you have any questions, like I'm a resource, you can ask me. So those are all opportunities where we can tell our loved one that we're doing this course. I encourage people to do it, to tell them. So yeah, WeTheVillage.co. It's very, like, Bob Myers helped us create the course. He did the research trial with us. He's doing the second part with us. So it's all, got his stamp of approval. It's real craft. We've added a few things in that could be helpful, but you can definitely check it out there at an affordable price.
That's great. And you mentioned worksheets, and I know part of the worksheet process is to work on a relapse prevention plan and a relapse scenario plan, and the idea, with some kind of relapse plan is, okay, what am I going to do if I do relapse? What supports am I going to reach out to? But it also applies to the, I'm saying that about the loved one, but isn't that true of the parent, that they should have, what are they thinking of for a relapse prevention plan, but what are they also thinking of when there is a relapse scenario? So that's part of it. You would have worksheets for that, correct?
Yes, absolutely. It's a whole module, because one of the alarming things I saw in my 2 years of doing the evening IOP at Hazelden in Chelsea was I would give relapse prevention worksheets to the people in my, there were 30 people in the psychoeducational part of the night, and half of them would throw out their piece of paper on the way out, or leave it, or just not engage. So if half of the people are throwing the relapse prevention plan out, how many of the people that left are actually sharing, oh, we did this at IOP tonight with their family members? So I always think it's a good idea, like in the village course, there's a relapse prevention plan, so we know what it looks like, because we could not have ever heard of it until we hear of it, or until it's too late. And being able to sort of have our own in terms of, if this happens, what will I do? Do I have the phone numbers for this detox if I need it? Like, kind of getting things in order just in case. It's like having Narcan. We hope we don't have to use it, but if we do, we have it. So setting up sort of a plan for ourselves and how we would want to react and respond, maybe based on how we have in the past that wasn't helpful to a potential relapse. But like, it's so, I'm like blown away that like family members don't ever get, or don't often get, the opportunity to like go over the relapse prevention plan with like their loved one and their loved one's counselor and treatment, whatever it may be. So there's a whole module on it with a lot of worksheet prompts, which was one of the things that we kind of added in because we found it to be super important.
Thank you.
Erica, and hi, Paul. I haven't seen you in ages and ages, but we're still plugging along here, obviously. Erica, thank you so much for everything that you've said tonight. And this has just really struck a chord with me about the relapse prevention plan, because our son is definitely seems to be on the right track, the right path so far, fingers crossed, one day at a time, all of those things. But he's also at the point now where as a result of the addiction and trying to get over that, but the doctors prescribed it, the whole Sackler thing, is that it cost him everything in his life. I mean, really, literally everything, including his teeth. So at 37 years old, he was told that they all have to go. Well, all 8 of the remaining ones. And my husband and I decided that he needed some teeth, and we were going to be in this with him. And he's been clean. Aside from the Subutex, which is a whole other, is he clean?
That's amazing. That's amazing.
Yeah. So we're doing that, but that's the kind of thing where on this side we're going, yay, and on the other side we're thinking, okay, it's really painful, it's really stressful, it's going to be a long commitment for him to adhere to in order to make this work, and so I'm thinking to myself, I don't want to be, have the blinders on, like I'm fully cognizant of the fact that this would be the perfect time for him to say, okay, I can't do it, because he was diagnosed with paludronic rheumatism, which is a really painful thing, and sporadic, and got him here in the first place. So I can see where this would be a place for him to go out, or this could be a place for him to suddenly he's soaring and he's off on his own life and he's smiling again, and which I hope is the direction it takes. But if it isn't, am I going to just be standing here going, now what do I do? So that you have this, a relapse prevent, and I'm one for lists and writing things down and being organized and having a plan. So this is incredible, and this is incredible timing, because he's scheduled for the surgery next week. And I just want to say thank you. So I'm going to go to wethevillage.co, right?
Amazing. Yes.
And start looking into
poke
being
around.
prepared, always the go step.
And
this was not a paid political advertisement.
you can always even Google relapse prevention plan. I don't think there's one unique relapse prevention plan on the internet. But if you can Google it and just sort of get an idea of what it even looks like and what the questions and the prompts are, and also be an advocate. Say I'm pretty sure when you're on Subutex or Vivitrol or any medicated assisted treatment like that, there's a card that you have or something that indicates to healthcare professionals that you are on this medication. So if I'm Jewish,
he had to go through the whole thing with the surgeons, and they were going to operate.
So if God forbid, chas v'shalom, I'm Jewish, sorry. There's a car accident, the EMTs know they need to push more morphine than normal because they're on Subutex, Suboxone, Vivitrol, whatever it may be.
Wow.
So sort of making it known, whatever you give him, know that he's in recovery from opiates. So don't let him leave with anything.
Okay,
yeah,
that's
great. That's a great step.
If he has a card, that's one of those things, because I don't want to ask him stuff. He's 37. I'm his mother, but at a certain point,
some people don't have cards. Yeah.
Okay.
But some people do.
Well, I can always ask.
It's not one of those commonly regulated things that I can fentanyl strips.
I'm allergic to penicillin, and I know they have those bracelets, but I don't have one. So
yes,
I'm probably get one.
I'm lactose intolerant, and I don't wear. I'm kidding. But yeah,
I don't think you're gonna be force fed.
Yeah, so it's making sure there's no opportunity for any sneaky behavior.
Okay,
good. And getting through any oral surgery when you're in recovery from opiates can be an awesome moment. It can like be like a, oh, I did it, you know? Because I mean, who likes going to the dentist? I mean, some people do, but it, you know, if it's painful and just knowing that you can tolerate it and get through it, that's a powerful, you know, sort of building on your own successes and
Good
building on
point.
your self-efficacy.
Cool.
Good point. Good point. Because he did go to get his prescriptions and stuff today, and
And having it sent here.
it's not and they're not narcotics, and that's a perfect place. Thank you for us to say, you know, this is incredible what you're doing. You're really, you know, you're getting yourself all set up and scheduled and dealing with it, and this is, we'll just have to keep doing
And
it.
he had all his meds sent here for us to also, which was cool.
That's great. He's just
That's the
safeguard, you
R
know.
in reinforcement right there. If
Yeah.
you guys do that, that's the big R.
Yeah.
And I will, we talked about relapse, so I will send an example that I found online of a relapse prevention plan worksheet. So you
Thank
can
you.
just see it. So to everybody on the call, I will send you that so that you just see it in case you're curious. And really, I
Thank
just want to say, you know, we try to keep these to an hour, and I thought this
Sorry.
was an awesome hour. And Erica, you know, I think I can speak for all of us to say that, you know, thank you. And this was really helpful.
It was so
And
nice being here.
thank you very much, Erica.
It was
Thank
a
you,
pleasure.
Erica.
I can
Thank
talk
you,
about this
Paul.
stuff
Thank you, Erica.
forever. It's my
Thank-
favorite topic. So
Right. And
sorry
we
I
can-
went over.
if you want to hear Erica some more, she's on this podcast called Hope Stream. So if you looked up Hope Stream, you will find Brenda Zane talking with Erica, and the two of them can talk. Man, can they talk? And you know, but they're not just, they're talking real stuff. They're, you know, I got so much out of that, and that was really the prompt for me to invite Erica on here. So great job. I'm glad you know, you all were able to benefit. And you know, next month we're going to look into ourselves. April 5th is going to be self-compassion, meditation, and self-care. So stay tuned.
That's
So
awesome.
thanks, everybody.
Thank you.
Yeah.
Have a
Thank you
good
much.
evening.
Yeah.
Thank you all so much. I really appreciate it. I'm